Hello, how are you?
Hello, how are you? Hello, Dr. Catherine Craven. Welcome to Sitla. And I'm so glad to talk to you. I can't wait for you to tell me about mental health and what happened in New York.
Well, hello to you, Dr. Carol Hullin in Australia, the primary leader of my main tribe, which is the Chilean Australian United States tribe. It's really wonderful to be here. And mental health, my goodness, this is a topic that is important every day of every year. And it's especially important, in a global crisis. Crisis also means opportunity. It means a time to really reflect about, you know, what's good for us, because clearly we know we're hearing all about things that are bad for us and dangerous for us, and let's talk about what is good for mental health. Get me started. What are some thoughts you have, and then let me react to your thoughts.
Firstly, I think through the pandemic, you realize how important is your loved one and how essential is scientific evidence to take care of people. And that's why we're engaging with your thoughts, especially with your present in your country, which has been very challenging, and in Chile as well. It's many thousands of people died because of this pandemic. However, today we're going to give some mechanism to keep going and to give hope.
Well, that's exactly right. And this isn't easy for anyone. And of course, there is stress and there is grief at the loss of life. We just passed, I believe it was the day before yesterday, we passed the 250,000 documented, confirmed people of the United States who have died from COVID. And we know there are many thousands more based on study of the data across each cause of death. And we know what the normal numbers are each year. And we also know that early on there was not enough testing. And so this is a lot to process and a lot to grieve. And we have to grieve. We have to feel those sad feelings. And I think that's an important thing about mental health is you have to acknowledge the feelings you're really having. It doesn't mean that you are living in those forever. You acknowledge them, you acknowledge the grief, the fear, the anxiety, and then you figure out, well, what am I going to do with this? How do I work through these feelings? And then once I've done some healthy working through the feelings, then what can I do moving forward to feel stronger, to feel safer, to feel more comfortable with the uncertainty that we're living with and with the risks that we're living with. And that's the most important thing, because it's really easy to run away from feelings. And we're taught, we're all too often socialized unintentionally in many respects to toughen up, don't talk about it, don't cry. And even when we want to comfort small children, we say, there, don't cry, it's okay. Well, um, you know, uh, after a point, one does need to stop the tears and take some deep breaths and move forward. But for a time period, and that time, how much time depends on the person and the situation. Crying is healthy. It's a sign that your body needs to release emotions, that you're feeling big things. And so if we run away from tears, if we run away from fear, if we run away from sadness, um, it's going to find us. So best to stop. If you need a good cry, have a good cry. Go find someone in your household that you love, give them a hug. If someone's not in your household you can talk to, have a phone call, have a little cry over the phone, or go by yourself. Find your most comfortable bathrobe, your most comfortable blanket, curl up, comfort yourself, and have a good cry. And then after you've had some tears and you've let some of those emotions out, take some very deep breaths. What do you think about taking the deep breaths? What do you think about that?
I totally agree. And you need to be disciplined as well to stop and see the risk and the uncertainty. But as long as you can feel your air, and that's what I've been looking forward to talk to you, because you are my source of inspiration. As you know, as a tribe, you need to ensure to connect with the people you love.
That's absolutely right. And You've always been my inspiration as well. And another thing that's so important, and we will talk more about very concrete things to do once you've acknowledged your feelings, whether you do so by yourself, which is fine, or with others, which is really a good thing. We'll talk about concrete steps moving forward. But I think the main thing is to know you're not alone. And there are people you can talk to. And one of the things that I've always valued most about our friendship is you always make me laugh. And, laughter, the old saying that laughter is the best medicine. Okay, is there anything funny about a pandemic? No, but is there still laughter in the world? Are there still many funny things in our lives? Of course there are. And laugh as much as you can, because anytime you laugh, it causes this reaction in your body where your body releases hormones, chemicals in your body that are endorphins. They're happy making chemicals. And so the more you laugh, the happier you are. And I think we've all noticed sometimes that when we have a cry, when we've been upset about something and that cloud bursts, sometimes at the end of it, we start laughing. We're laughing. We don't even know why we're laughing. And it's because your body wants you to be happy. Your body wants you to be happy. And your body also recognizes that it may not feel okay right now, but chances are that if we work on it a little bit and we take some positive steps, it's going to be better. And in most cases, not every case, of course, we're not about telling falsehoods here, but in most cases, if you take those deep breaths, you move forward, you come up with some plans on how you are going to do the things you have control over to feel better about a situation. And you're going to connect with people to talk you through the issue, it will be better. It's going to be better, and probably it's going to get way better. It may get wonderful, really much faster than you think. And I think that that's another thing about mental health, and this is something that I've had to learn very much. Is I used to be someone who I don't have feelings. I'm strong. And then I was someone that admitted, okay, I have big feelings. And then I was someone that when I feel overpowered by these feelings that I'm allowing myself to feel, and if you feel overpowered by a big feeling, sometimes people can think about desperate things, maybe hurting themselves, maybe permanently hurting themselves. Maybe they feel in a moment that they don't want to live. Well, you know what? Every time I've gotten to a point where I feel that overwhelmed and that upset and that desperate, gosh, if I take some deep breaths, drink some water, talk to somebody, or just have a good cry and go to sleep, you know what? Usually by the next day, I already feel less overwhelmed and I do not want to hurt myself. I do not want bad things. I'm talking about the worst moments in life. I certainly don't have these feelings of overwhelm all the time. Otherwise, I'd tell you, I'd say, hey, I'm having big problems and I'm talking to a professional. The fact I'm trying to say is we're all human and we all have these moments. And, don't do desperate things. Take a pause. Take a pause. Take a deep breath, have a good cry, talk to somebody, go to sleep, get some rest, drink some water, nourish your body, eat something good for you. Just have a snack. And you know what? I'll tell you what, I'm going to give you permission. We can't eat junk food all the time because that's not good for physical health or mental health. But if you're feeling really terrible and you need to treat yourself, you need to comfort right now because those bad, overwhelming feelings have happened, have that good cry, talk to somebody, and then why don't you have some chocolate? Have a little chocolate. You know what? And then drink some water and then get some rest. And you know what? Your dark night of the soul will dissipate, and the sun will come out again, and you will find that your mental health, your state of feeling, transitions to something better. Now, I want to bring up something else. I don't want to I don't want to minimize or make light of people have some very serious mental health conditions. These are not character flaws. These are not because they're not making efforts. That's another category, mental illness. There should be no stigma. There are ways to treat and manage all of these, and they require professional help. And that's in some ways another conversation, perhaps for another day. What we're talking about right now is what everybody experiences, which is down movements, moods, downward spirals from time to time, feelings of desperation from time to time, fear, sadness, grief, anxiety, the things that make us human, right?
That's right. And it's quite natural, Catherine. And I just remember many times when I met you here in Australia and in Europe, I have to tell you a secret because I laugh so much that you make me go to the toilet because everything relaxes so much. And also, mental health is about preventing illness.
That's
Therefore,
right.
we know ignoring illness, but it's a healthy interaction to declare your fear. And also, as you know, we do always extraordinary things. As you know, I'm right inside of a car because we discover we can visit our beautiful Faye. You know how much I love Faye. You met her here. Such a beautiful lady. We've been waiting for months. But I couldn't stop making these extraordinary sacrifices to teach people that everything is possible if you got the right attitude.
That's right. And, you're doing your best to do two things at once, which is wait until it's safe for you to visit Faye. Let's tell our friends who might be watching this, who is Faye and how old is Faye?
Well, Faye is actually already turned 80 this year. However, she was the first lady who taught me how to be a lady, if you can explain that. And you know, I grew up in South America, and she was the first, I mean, she was Mrs. Hullin. When I got married and asked for Mrs. Hullin, I thought she's not here, but I became Mrs. Hullin too. Therefore, she's my role model of how the soul, the type of soul I want to be. And as you know, we have drinks every week, and we definitely keep healthy. Our mental health was a priority with her.
Absolutely. And now is Faye living in a senior home? Is she living where? Okay. So she's 80. So that means, she's at a much higher risk for COVID-19, the coronavirus. You didn't want to risk compromising her health or transmitting it to her. So you could not visit until
Correct.
now.
Yeah, correct. Well, I'm not allowed to visit her myself, but my daughter will get in with a mobile phone, will give us a telehealth because it's still on restriction.
There,
And also, as you very well said, she is the most vulnerable group. Then the COVID-19 cannot get in there because we are healthcare professional over here. Therefore, we need to protect her. But it's so important to make the effort, to make a little bit an extra effort to mental health because she's a family. Therefore, the family, you need to make the effort to connect.
and that is a super good point. Not all efforts take an hour and a half of driving time, and a special. The child can go in, but then you call outside. It's wonderful that you're doing that, and it shows that where there's a will, there's a way. You cannot go in. Your daughter can go in, but then you'll talk to them on the phone, and it's a compromise. But better to make a compromise about how you connect and interact than to compromise her health. The different word, the different meaning of compromise. Um, and it gets very easy for us in our homes. Some of us, I know, might be watching and don't, are lacking something. But I think a lot of the people who are watching have the basics covered. You have a roof over your head, you have food, you have a television, you have some entertainment, and you maybe have, you've got your mobile phone. You've got access to the internet. Maybe you have a laptop or a desktop computer, and it gets really easy to just get in our patterns of connecting and going about our business and staying kind of electronically tethered. And in fact, you know what, picking up the telephone and having a phone call, that feels better. That's a more intimate level of connection, and that's something we can do and still keep people safe who are in high risk categories, isn't it?
Bingo, Catherine. I think you need to have a little bit of time to develop your mental health strategies, especially remembering pre-COVID and also developing a plan for you how to return to the new paradigms. I mean, this is new, and as you know we don't have vaccine, we don't have a clear treatment,
Not yet.
and some countries don't have resources to respond. Therefore, mental health is the key. Otherwise, these consequences will be 40 or 50 years post-COVID.
And something that you said is, develop a plan. Write those things down. It's intentional. When you write something down on a piece of paper with your pen or pencil, you've done something concrete, which is, here are the steps that I'm going to recommit myself to, we hope. And, if you haven't been wearing a mask outside and you haven't gotten sick, you've been very, very lucky. However, you can commit to doing so now, and you should. And that's because it's not just about you. And I know that most of the people out there, if they stop to think about it, really, they would be horrified if a neighbor, a family member, a beloved grandmother got sick because they didn't wear a mask. I mean, this is a very simple, or because they didn't wear a mask and they insisted on being close together inside. Um, you
That's
know,
exactly right, Catherine. I mean, remember, not many decades ago, we didn't use seatbelt. We didn't have insurance. I mean, this is a new culture. Maybe you don't have any symptoms, but it's about protecting you and working as a community because maybe uncomfortable the mask, but would be very uncomfortable to know someone went intensive care because of your careless behavior. This is only a secured. It's like a insurance for your safety, basically.
you know, um, uh, there was there's been a comment that's going around on the internet, a meme, and it says, "Let us stay apart now, so the next time we're gathered, we're all there." Because you know what? Here in the United States, next week we're about to celebrate Thanksgiving, which is a secular holiday. It's not a religious holiday, but it's a very cherished American tradition. I will briefly acknowledge the fact that we have some attachments to that holiday that glorify the past regarding our interactions with the Native Americans who lived here, and that glosses over some uglier historical realities. So, with acknowledging that, we still love Thanksgiving because to us, it's not even so much a celebration anymore about that first holiday, that first autumn, that the very first pilgrims were in the United States and they needed help, they needed community help, they needed support. And the Native Americans shared their harvest with them and shared the bounty that they had. So it's really, that's a wonderful thing. We can also hold up the fact that we didn't do the right things by our native peoples, and we still don't too often. And we can also still love this holiday and understand that what it's come to mean to us is family and together time and a wonderful feast and settling into a new rhythm for winter. So this is a very, very difficult sacrifice for Americans who I'll just say it myself, tend to be a little bit spoiled and a little bit selfish. Not bad people, good intentions, but very used to having a comfortable life, many of them. And for us to think about giving up Thanksgiving dinner together, that's a big sacrifice. And at the same time, greater and greater and greater numbers every day are canceling their plans for next week and realizing they need to stay home because it is not safe to be in other people's houses right now. And the thing about the virus is it doesn't think, it's a virus. So therefore it doesn't care whether or not you're related to somebody else. It doesn't care whether or not those people are clean. Of course they're clean. Of course they do their best. It doesn't care if those people have, for the most part, been in their houses. What it is looking for is an opportunity. And the opportunity happens when people go from one house to the next, when they go to the grocery store, and then when they sit inside together and they start breathing the same air that each other's breathing, particularly if it's for extended amount of times. And when you're eating and talking and laughing and spending hours together feasting, that's a perfect opportunity for, let's say, one person, there are 10 people or even 6 people around a dinner table. One person picked up the virus a couple days ago, a few days ago, just making a run to the grocery store. That's all, you know. Then they rubbed their nose before washing their hands when they came home. Just a moment. Okay, that's all it takes because this is a highly contagious virus. And then this family, which has tried so hard in their own homes to do the right things and they've been wearing masks outside. Um, you know, they come together and they have this feast, and somebody gets several other members sick. That's exactly how this virus is now spreading. It's spreading in small groups in the United States anyway. It's spreading in small groups, in small group gatherings with groups of people that know each other and they think they're safe. And it just doesn't work that way. And so something that I think this is, I want to make sure that I get it right. I may not get it exactly right, but the American Medical Informatics Association scientific annual symposium was earlier this week. It actually started, we changed the dates a little bit because it was all online, all virtual. And so it started last Friday and ran through Wednesday this week. And in one of the highlights of the symposium, really in a highlight of any symposium we've had, Dr. Anthony Fauci, who is the director of the United States National Institutes of Health specific agency, which is called it's the National Agency for Allergies and Infectious Diseases, and he's an infectious disease expert, and he's one of the world's most expert infectious disease scientists. He was heavily involved in understanding the HIV and AIDS outbreak when that first came on us, and has been instrumental in all of the science to come up with ways to public health campaigns for people to behave in safer ways. Doesn't mean there's no risk, but safer ways. And he spoke to us at the symposium. We had a fireside chat. He chatted with the director of the National Library of Medicine, which is also a research agency within the NIH, which is directed now by the first PhD and nurse, Patricia Flatley Brennan, who is a colleague of ours that we know through AMIA, longtime informatics researcher. And they had a fireside chat, and a huge number of AMIA members tuned into this. And Dr. Fauci was warm, and he was open and engaging, and he spoke to us as scientists, and he was wonderfully, reiterating his message. And he was just so touching many times. And he said, let's give up Thanksgiving dinner together so we don't have an ICU Christmas. ICU stands for intensive care unit in the hospital. And that was a really powerful message. And he's like,
I thought that was brilliant, Catherine. I thought it was brilliant because it was about 3,000 scientists,
yes,
and he made a very good impact. Because in a sense, it's just common sense to take care of yourself, and mental health. It is so relevant because you have to be alert to this risk,
that's right.
alert to make informed decisions. And because the social media is really confusing people, because some people really get to the fear factor.
Yes,
Desperate people make desperate decisions. Therefore, when I listen to you with this expert around the world, I mean, he was right from the beginning. But when politics get involved, I mean, it's rubbish. It's rubbish. And that's why I think it's very important for us to provide these mechanisms to get informed, quality of data, quality of the source. I mean, you are more expert than me. Why it's so important to get right the information? You're a journalist. Therefore,
no,
it's so important
and
to
you're and you're
transfer science.
a nurse of many, many years before you got your PhD. So, it does connect with mental health. All of this connects with mental health because there's a lot of noise out there. Everyone's yelling. A lot of people are upset. And of course, there are always some bad actors who want to manipulate us into listening to false information, lies, twisted evidence for their own purposes. And then that gets a lot of other people who have good intentions but are not particularly well informed yelling at each other. So, my advice about that is the same as yours, which is don't listen to the nonsense. Don't get caught up in huge arguments. Take some deep breaths. Go see online what Dr. Fauci has to say. That's FAUCI, Dr. Anthony Fauci, the head of the National Allergy and Infectious Disease Institute for the National Institutes of Health. And I'm sure there are other experts within Chile as well, in addition to our Chilean Australian Dr. Hullin. Look for the facts, and the facts remain very, very simple. This virus has not changed. The virus is the same, and the facts are the same, um, which is stay in your house as much as possible or in your yard if you have a yard. Okay. When you're not in your home, don't let anybody who's not part of your family, who doesn't live there, into your home. When you go outside, if you go outside of your yard, as in if you take a walk down the sidewalk or down the street, if you go to the park, or if you have to go to the grocery store or the pharmacy, wear a mask and stay at least 6 feet apart. That's a couple meters apart, because even if you have a mask on, if you stay apart and you both have masks on, you have cut that risk way down of transmitting. And don't we just can't go shopping right now for fun. We can't go to see the football games. We can't go to see concerts, and we really should not go to big backyard parties, where I know it's getting warmer down in the upside down part of the world. It's getting warmer. It's summer. But we cannot do those backyard barbecues or picnics. We can't go, have nice lemonades and beers together in little groups and laugh like we like to. We have to, if you go to a park or a yard, it has to be a limited number of people, because you all have to stand a good couple meters apart. And but can you do that? Can you go outside with your masks on? And if you're having, we'll say lemonade because there are children present, right? If you're having your lemonade outside in the backyard or the park in the socially distanced gathering, take your mask off long enough to have a couple drinks and then put your mask on. And you can't hug, and you should not play touch sports. You really can't play sports at all, because that causes a lot of heavy breathing and then you're all together. But is it still possible to connect that way? Yes, absolutely. And I've said, we're entering in the northern hemisphere. It's becoming winter, and I said it looks like we're going to have a lot of parkas and hikes outside wearing parkas. It's going to be a very athletic winter for us, because we need to get out, we need to move, and we do need to connect with other people, but it has to be at a distance with the mask on outside, and they can't come into our homes. And then when you do come home, strip that mask off and put it in your laundry pile and wash your hands right away. And make sure to keep washing your hands. And you know what? These are the steps that we will have to take and keep taking until we have the vaccination. But this was something else, and this is good for the mental health as well. There's big hope, and people may have started to see on television. I'm sure the news is spreading, but just to get it on record here and to really think about it and feel it regarding mental health. There are 2 vaccinations that have gotten all the way through the very rigorous clinical trial stages. This is the scientific testing method for testing vaccines to see not only do they have an effect, do they work, but are they safe, and are they safe in people? And not only we're talking in the above 90% effective. That is far more effective than most vaccinations are for, say, influenza. This is really, nobody thought that this could be done with this level of efficacy in this short amount of time. And now, so the vaccinations are on the way. And that, roll the shoulders back, take some deep breaths for mental health, because they're coming, and eventually everybody will get one. And so that's a huge relief. Think about it. Even a couple months ago, we didn't know. We really didn't know. And now we know. So that's one thing that's a little bit less uncertain in our world. And that's a positive thing. So, what would you like to say about that?
I think it's just to show you the power of human collaboration. And obviously, the vaccine is definitely giving us hope. And obviously, the logistic of it, I mean, really show us that we're capable to have better outcomes if we're capable to collaborate. Because regardless of your social status, the virus doesn't discriminate. And usually, as you know, it's very much a human behavior change rather than treatment, because treatment is very late. I think if we invest in prevention and educating the community, and what are we doing now, connecting and helping each other to understand, because many of paradigm have transformed. We don't know how we're going to be living in the next 10 years. We've been traveling. I mean, we're not allowed to leave the country. And many people, we don't know when are going to visit you or when you can come over, you know?
And, I think we'll get there sooner than we think. I think we will. I'm feeling positive, and with these fantastic vaccinations and more than one. So it's been recreated by more than one. And when you talk about collaborations, these are many, many different pharmaceutical companies and research groups working together to come up with this. So power of collaboration, power of connection. I think we will be able to see each other in person sooner than we think. But yes, yay, take a minute, clap for that. That's super positive. However, our paradigm for now is we have to just be disciplined in the sense that you just get used to doing these precautions and accept them. Don't fight them. Don't fight them, because I'll tell you what, I have a really good time. We do have a yard with our house, and I have a really good time standing in my yard and talking to my neighbors in their yard. And this is something that's normal. We do that anyway. And okay, it would be nice if they could come in our house. And I'm going to have to put on my parka pretty soon, my big heavy winter coat, to stand outside. But that's fine. I can go outside and breathe the fresh air and take deep breaths. I can go for a walk with my neighbors around the block, a couple meters apart with our masks on. Life is good. I can talk to you this way. I can pick up the phone. Something that we're going to do, and a lot of Americans are doing this, because we're realizing and canceling our Thanksgiving dinner plans because the virus has just taken off. We have not been disciplined enough. And now we're seeing the virus rise, but people are coming to grips again with the discipline to follow just the steps we talked about. Something that's going to be really good for our mental health is, the company Zoom that has the online platform. And you can use a certain number of minutes. I think it's up to 40 minutes at one time for a free call, and then they'll cut you off if you don't have a paid subscription. They've opened up the platform for everybody with no time limits over Thanksgiving. And so,
Fantastic.
yeah,
That's
and
fantastic. You see,
yes,
it's a little sign, a little step. We actually demonstrate that we're here together. It is a public health issue. We're not alone. Every country around the world is affected. I mean, in Australia, we call the bubble. We got bubbles, the family, and you obviously have to very aware and alert. If anyone new come to your bubble, you might make sure infection control strategies. But at the same time, you cannot exclude these people. You need to learn how to interact in a new manner, because this is a new way of living. And our mental health, as you know, it's sometimes it's not really recognized through the health services, but you need to develop friendship, interact with your neighbors, interact with the people who supply your food, because you cannot wait for the vaccine. This is happening now.
it's going to, and here's something else that's really important. Uh, it's, even though we think that the vaccine will start to get distributed in the probably starting around February or March, okay, the distribution will start, but it's going to take many, many months to get this vaccination available, you know, everywhere. Um, there'll be waves and waves of more vaccine produced and more people getting it. And just because some people have had it doesn't mean the rest of us can just be like, oh, we're safe now. We all have to have this before we're safe. And it's going to take time. And I'm telling you what, it takes a long time to vaccinate 7 billion people, but we're going to do it. We're going to get there. And, and by the way, by comparison, it normally takes many years to develop one effective vaccination. We have two versions of it produced in two different groups by some of the very best scientific companies in the entire world and other researchers working with them. And we did it they really started working on it seriously in March. And it's only November. And so this is many, many, many times faster. So I know I'm confident this is not going to take years for everyone to get the vaccination, but we, for our physical health and for our mental health, we hang on to that hope. Yay, the vaccination's coming. But we maintain our protocols, our new paradigm of our safety behaviors until we all have the vaccination, all of us. which is probably going to take through most of 2021. But hey, that's fine. We're doing this. We can do this. We're creative people. Everybody that's alive today is alive because of all those survivors, right? All the
Bingo,
people that came
bingo.
before.
I think just spot on. That's exactly right, Catherine. We need to be creative and very disciplined because the wisdom of human behavior comes through your own lifestyle. I mean, you can be waiting for someone to tell you. Maybe it's very violent for you because you're not used to it. However, I think we are together, even all the country, the vaccine for the first time in the human history is going to be available because you remember it's a market about this vaccine, but in this case, it's two options. Therefore, we're not monopolizing the options for some countries and others they're not having access. I think I got a lot of hope, Catherine. At least I can see a future with this strategy of from the science point of view rather than political and two very very stuff. Then it's very fearful for people who never been confronted with this pandemic.
Absolutely. And something that I find helpful, and I know others do too, is to remember back to the Spanish influenza pandemic of 1918. And that was actually, we say 1918, but it really went on for 2 years. It was and there are many photographs of people with masks on, exactly like the homemade masks that we wear now. And, many, many more people died then than now, because we do have much better, faster ways to talk to each other, and because we have been spreading the word. The issue is, we've talked about the manipulating noises, the people who have bad intentions or their own intentions, and then people who start passing along false information in panic and fear, even if they don't have bad intentions. And so, we have to ignore that noise. We have to focus on what are the actual scientific and health experts saying. And then we have to do those things and just keep doing them. And we're going to get through this. And the more that we do that, the fewer people that are going to die from this, right? I don't know about you, but the idea of less people dying makes me really happy. That, what a triumph, what a human triumph, if from this point forward we all say the vaccine's coming, I have hope, therefore I am going to absolutely do what I need to do. I'm going to wear my mask when I'm outside, and I'm not going to break those minor public health guidelines. I'm going to do these things, and I'm going to do them all the time. And to think about how many more people will still be with us, that we know personally. Have you known people that have gotten sick from this virus?
Yeah, actually, unfortunately, in Chile, as you know, it's 20 million people and it's about 15,000 people dead. I mean, it's the same number of people and it's Australia. And I'm very confident of this hope because in Australia, having 20 million, 22 millions, people got sick but recovered very quickly. But it's about 900 people died. I mean,
Yeah.
it's different approach when you have a public health initiative to respond as community. However, in Chile, it's a little challenging because people don't communicate one another. I think the key aspect here, especially for mental health and for preventing the virus, is to know each other and to know each other in a sense, not only to exclude people who get sick, but to rescue those vulnerable communities. You know, elderly people is at risk. You know that certain chronic disease patients are at risk. Therefore, you can prevent a lot of this stuff. And now, why I'm talking to you, because personally, you are my inspiration. You are my medicine for my mental health. Because I remembered all the good stuff, and I know people who've been positive, but they have recovered because they're doing the right thing. But at the same time, know many people from aged care that unfortunately they didn't get the care they deserve, and homeless people are being very at risk.
Yeah.
Therefore, today, as long we keep positive, I think we got a great future.
Absolutely. And the reason I asked if you knew people that were sick is, I've known many people personally that I know in person. And I also have quite a number of friends that I know through Facebook. who've gotten sick. Now, we've been very lucky and none of them has died, but some of them got very, very ill, and some of them were hospitalized for several weeks. And and they ranged in age from being, in their late 20s up to early 70s. So, yes, the older you are, the more vulnerable. If you have cancer and you're taking chemotherapy, if you have certain other underlying conditions and your immune system is weaker, you are more at risk. But that doesn't mean that, healthy young people carry no risk. You know Anyone can get this. It does not discriminate. It doesn't matter how many, fancy clothes you have or how much money you have in your bank. It matters, are you following those public health, those safety precautions? And so we don't want to play, we don't want to gamble, because you cannot predict. There's no way to predict who's going to get it. And we also don't know who will become extremely ill. Again, the chances are that if you are older or already in a health compromised situation, you are more likely to get seriously ill and you're more likely to die. But more likely doesn't mean for sure. And we don't want to gamble. And so, yes, there's hope for recovery. But at the same time, I have never, I've met a lot of wonderful Chilean people, and I consider them part of my tribe. And I don't know anybody among that group that I think would be casual about the idea of accidentally causing somebody else's death. I mean, I don't want that on my conscience.
So that's right. Of course, and we as healthcare professionals, we're very ethical about caring each other. I mean, this is about science with conscious and caring attitude. Especially, I think, Catherine, it required a new switch on, keeping at home healthy. I mean, it's very hard because you miss your family, you miss the community. However, I think if you keep alert of the encouraging behavior you need to be conscious, we can prevent so many impact in the future.
And but I do want to bring it back around again, to say, okay, this is all positive and uplifting, and we're excited because we're talking to each other and we're connecting. We're practicing what we're saying and it making us feel good. And it's Friday night here, and you're going to visit your beloved Faye there, and this is all positive. So we're having a positive moment. But um, the reality is too, there have been many moments where I have had to have a good cry, or I've just been really bummed out, and I need to do something about it. And I think we just need to be honest with ourselves. It's not like we need to get on the, we don't have to all get on YouTube and talk about everything all the time, although we can. It's very egalitarian. If you want to, you can. I'm saying this not to be soul bearing, but to try and say, I'm pretty sure that Dr. Anthony Fauci has had some bad nights, and some bad moments during all of this. Everyone has stress and everyone feels the strain. And if you are having a bad moment or some, you are human. We are human. I am human. I've had bad moments. And the thing is to just realize that everyone everyone. Let's think about that. When there aren't that many times when everybody in the entire world is facing the same thing all at once as one huge community, right?
Bingo. I think this is what is actually united ourselves because we all living the same disgrace of a virus we cannot control at the moment. And it's actually changing the whole paradigm. I've been doing some research into cybersecurity, and the technology got a big role in this way of responding to these pandemic waves. And also, Catherine, as you know, in medical informatics, I think we have a lot of evidence for decades that people need to connect with technology. However, we never put at risk human dignity through this process. And that's why we dedicate ourselves to provide some answers, especially not only for the mind, but for the soul with this medical informatic approach, then it's actually looking forward not to give only answers to the pathology, but to prevent a lot of the pathology. And at the moment, the virus, it's all about prevention, and people don't understand that.
And in terms of them, yes, absolutely, absolutely. And we don't have a cure. We have preventive steps, which we all take every day with our masks and our social distancing and our hand washing and our not meeting in groups and not letting others in our homes. That's prevention. The vaccination is prevention, but there's no pill to take to cure this. There's some medicines we now know are more effective to help your body fight it off, but this is one that we don't want to test. We want to prevent it. And prevention, to circle back to mental health. We were talking about the fact that everyone has periods of time when they have a mood when they're very overwhelmed and down and their mental health is not feeling good, and maybe it lasts for a day or a couple days, but then they're able to come out of it. And we also talked about very serious long-term mental illnesses. Some of those have more of a genetic component, and you're more likely to either have, from the start, and they've developed because you were born with those genes. But any one of us can wind up developing a terrible depression if we do not attend to our fears, our anxious feelings, our moments of sadness, our grief. If we allow these things, we can be vulnerable to worse anxiety, and we can be vulnerable to depression. Any one of us, and that's a very human response and mechanism. And we want to prevent that too. We want to prevent a depression or a serious case of anxiety that become. We don't want those to become chronic. So I do want to say, if somebody out there is watching this, and if you've had more than, I mean, we've all had many months of stress, okay? And I know there are a lot of people that are a little bit depressed. So, another preventive measure that we need to take in addition to our virus prevention is, let's talk about some very concrete steps to boost that mood, because a lot of people are experiencing a low-lying depression and it's becoming a little bit more chronic. And that doesn't
That's
mean
exactly
it doesn't mean
that's
that
exactly Catherine. It's
it
spot
doesn't
on
mean that
because in a sense
no,
you're
go ahead.
weak. It doesn't mean
No, no,
what
no,
it
no.
means, Catherine, then acknowledging those feelings, firstly, you don't let it go and it become a pathology
That's
because, in a sense, it's quite natural to feel happy and sad sometimes. However, with this crisis, you need to be aware. You need to have very alert your mind and your heart to ensure you don't get to a depression, a chronic depression, then it's
you don't
actually
let
you're
it
not
get,
going to
and
exactly,
you let it get any
exactly.
further. It may, okay, maybe the reality for a lot of people right now is there's some of it because this is tough, okay, and we're all feeling it. The most brilliant, tough, strong, wonderful, accomplished people, I don't care how much money or how smart or how many degrees or how many scientific accolades or whatever, everybody I know has experienced some chronic anxiety and chronic depression surrounding this. The idea is, let's minimize that now. So let's take the concrete steps. In addition to preventing the spread of virus, let's take the concrete steps to, let's minimize that anxiety. Let's minimize the depression that many people are experiencing in a low level but chronic way at this point. And one of the ways to do that we talked about is connecting, and whether it's through Zoom, for free online at 40 minutes at a time, or making a phone call, or visiting your neighbors outside, and going for walks outside. Something that I have found is really, really useful, and it doesn't take much time at all, is if I'm starting to,
Wonderful.
I'm feeling, and it doesn't take money, and it doesn't even take somebody else.
That's right.
If
Therefore, Catherine, I will actually put in the, I got only a couple of minutes left, but I want to put this. What is the final message I can put in Spanish for all the people in Chile, especially all the team from Sitla, they're listening to you and they said it's just wonderful to listen. They're very, very embracing all your tips because they're practicing English. That way, when you visit us in Chile, everyone can talk to you. Nicolas, Edgar, Gladys, Mario, Cristobal, Alejandro, everyone want to meet you and obviously embrace you. What is the key message you can send to everyone?
Well, the key message I'll send, but I want to finish this last little thought, which is, go outside several times a day. get some sunshine, and take some deep breaths and just roll your shoulders a little bit. Relax. Take some deep breaths, go outside, because when you are outside and you are not interacting with groups and spreading that virus, but you're outside in nature, and suddenly it tends to cut problems down to size. And your feet, because it's warm there, put your bare feet on that ground. Touch that earth,
Wonderful.
you know?
Fantastic. Therefore, doctora Caterina Craven dice, salga para afuera, sienta el sol, relaje sus hombros, sienta el aire y sobre todo ponga los pies en la tierra, porque si está bien en medio de esta crisis, todo va a estar bien también. Muchas gracias. Thank you so much, Catherine. You are the best. I think it's been amazing. I can't believe it went so fast. I have arrived to
You
the
have
home
arrived at
of
your
Faye.
destination.
Therefore, we will visit, and we ask Nicolas to actually take us offline. That way I can at least talk to you for a
Absolutely.
little
But
while.
before
That
we go
way I can.
offline,
Okay,
I want to put it on record that I would
thank.
like you to give Faye a big hug for me, okay?
I will. I will. I will ask Elena to give a big hug in your name. Okay.
And we can do
Therefore,
this.
thank you very much.
We're doing this. We can do this,
Of
everybody.
course. Thank you. Thank you very much. You're the best. Nicolas, you there?